Right, Jay, as we know, back pain can leave you flat on your back, and over-the-counter pain medications or heating pads may work for a few hours, but they usually aren't long-term solutions. Our next guest can help find the source of the pain and treat it once and for all. Please welcome board-certified orthopedic surgeon Dr. Richard Francis with Spine Associates. Hi there.
Fine, thank you very much.
Back pain is one of those things that's going to get just about everybody at some point, but for some people, it really is debilitating.
Yes, absolutely, it can be. It is, in fact, very common. If you look at the figures, about 85% of patients of the population will have back pain at some point during their lifetime.
Yeah. When do we know that that back pain is not just something that you can deal with for a little while, but something you can add even more injury to if you don't get a doctor to look at that?
Well, first of all, if you think of it, it is ubiquitous, and many times it's a simple matter, and sometimes it's a serious matter.
Yeah.
In general, the majority of back pain will settle on its own. 50% of patients who have back pain will usually settle within a week. 75% will settle within 3 months on their own. And in fact, if you treat it with conservative measures, 90% of patients will settle within 6 weeks. So what it says is that if this doesn't settle within a few weeks, this is something that needs attention. Most times, however, it will settle on its own or with simple measures.
Because it's hard for us sometimes to figure out, is it the muscle around the back that's causing the problem, or is it the spine itself? And that's when you really have to pay attention. What kind of patients do you normally see? What's usually their issue?
Well, as a specialist spine surgeon, I see adult patients and I see pediatric patients. And the patients I see complain of spinal pain in the cervical spine, in the thoracic spine, in the lumbar spine, and in the sacroiliac joint. Now, having said that, there are niche areas that I have. There are areas of special expertise that I have. Specifically, I see patients with spinal deformity, such as scoliosis, a curvature of the spine. I see patients who have had prior spinal surgery who require revision or reconstruction because of unsatisfactory outcomes.
And that's where that specialization really comes in.
And that's where the specialization comes in. And we are, at Spine Associates, we're leaders and first movers in robotic-assisted spinal surgery.
Which, you know, a lot of folks had parents who had back surgery, and they watched that recovery process, and they're thinking, oh, I'd rather deal with the pain every day than get it. But things have changed. They need to know that technology has changed. You mentioned robotics.
Yes.
So tell us what a big difference that can make in a back surgery in terms of your recovery, less risk of infection, all those types of things.
Well, in general, when we do any kind of spine surgery, and whenever we decide on particular tools to use, our goal is to have a very satisfactory outcome. And we want to do procedures and use technologies that allow us to limit the amount of time on the operating table, limit the amount of dissection that we do, the amount of soft tissue exposure, the amount of blood loss, and achieve fast recovery times.
Yeah.
And spend less time in the hospital. And robotic-assisted spinal surgery does help us to do that because it reduces all of these factors I just mentioned.
Yeah. The other thing that is so critical is if you have pain, finding out exactly the source of that pain. Because in the past, sometimes we would treat the area, but not really get to that key source of the pain. Yes.
You know, the principles of identifying the source of the pain have not changed, but the techniques that we have improved. Basically, we must always take a diligent history, a thorough history, a thorough assessment of the relevant factors that cause the pain, the things that make the pain worse, the things that make it better, things that clue us in as to where it might be coming from. And once we're done doing that, we then embark upon a very thorough physical examination.
Yeah.
Having completed the history and physical examination, we then start our diagnostic process, diagnostic imaging or diagnostic testing.
Right. You mentioned earlier the sacroiliac joint,
yes.
Right? Okay, tell us how you all discover an issue there and how patients can get well.
Well, the sacroiliac joint is this joint right here that sits between the sacrum and the pelvis in very close relationship to the lumbar spine. And when someone has back pain, we have to consider the sacroiliac joint as a potential source of that pain. In fact, it was...
So oftentimes has that been missed sometimes?
For several years, it was missed or considered only occasionally. We now know that it accounts for about 30% of all back pain. And so we embark upon the same measures that we just talked about. We take a thorough physical exam, a thorough history. We examine the patient and use certain provocative tests. And once we have done those things, we have a pretty good idea as to whether or not it is a source of pain.
Yeah. All right. So better be safe than sorry. You mentioned that you are a specialist, so you would be referred by someone. But if you have that back pain, as you mentioned, if you've had it for quite some time, you got to make sure that you get in before you cause even more damage.
Yes, I think so. It's very important that we understand that this is not something to be ignored. There are times when it can be quite serious and nothing beats a proper exam.
Yeah.
So I would advise our patients out there who are listening to be in contact with their family practice doctors or their primary care providers, and if necessary, see a specialist.
Yeah, yeah. We mentioned earlier that if you have procedures now that less downtime, less invasive. The iFuse procedure, the benefits of that is what?
Okay, well, the iFuse procedure, the SI bone iFuse procedure, is a procedure designed specifically to treat sacroiliac joint pain. Now, this graphic illustrates the sacroiliac joint. You can see it's sitting there with, right here between the sacrum and the ilium. It has a limited amount of movement normally, but for its small size, can be a big pain problem. Now, what we do is, for patients who qualify for surgery, for patients who have already had conservative measures and they haven't worked, we do this minimal access procedure where we stabilize the joint. And the graphic again illustrates it. It's done through a small incision, less than an inch, over the side of the buttock. And under X-ray guidance, we're able to place 3 small dowels through the sacroiliac joint to stabilize it.
And those are the dowels right there that we have on the set right here.
And these are the dowels right here.
Point that toward the camera there so we can see that.
And they are porous coated. It's made of titanium. And it slots in across the sacroiliac joint, just as you're seeing right there.
Yeah.
The whole procedure takes less than an hour. And it involves either a very short stay in hospital. Patients will go home either the same day or the following morning.
Yeah, this is not your grandpa's back surgery surgery at all.
No, it's totally different. For starters, it is minimal access.
Yes.
So there's much less dissection, very little dissection, almost no bleeding, very safe, and the recovery is very rapid. The initial results from this procedure have been extremely encouraging.
That's good to know. Good to know. Thank you very much. And before we go, I got to ask you where you're from, because I know people are thinking, where's that accent from?
Jamaica.
All right. You know, the entire time I was thinking about being on vacation in Jamaica when I was listening to you. All right. Well, and mark your calendars. Dr. Francis will host a free seminar on low back pain on Wednesday, April 16th at the Hilton Garden Inn in the Galleria area. To book your spot, call the number on your screen. And to learn more about SI joint fusion, just log on to sibone.com or connect with Dr. Francis at myspineassociates.com. You can also call this number right here, 713-383-7100, 713-383-7100, and get rid of your back pain for good. Thank you very much.